BioNTech COVID-19 vaccine will be impacted for a short period. This expansion work means that Pfizer is temporarily reducing deliveries to all countries receiving vaccine manufactured at its European facility, and that includes Canada. Before discussing this further, I wish to be very clear from the outset. This is a temporary delay, and we remain on track to have enough approved vaccines for everyone who wishes to be vaccinated by the end of September 2021.
Before going further, I want to be very clear from the very beginning. This is a temporary delay and will have no impact on obtaining enough approved vaccine doses so that all those who wish to be vaccinated by the end of September will be able to get the doses.
Pfizer believes that by the end of March, it will be able to catch up such that we will be on track for the total committed doses for Q1. This is unfortunate. However, such delays and issues are to be expected when global supply chains are stretched well beyond their limits. It was with precisely these types of issues in mind that Canada pursued the aggressive procurement strategy that we did. Canada has in place 7 bilateral agreements with leading vaccine manufacturers and developers in order to ensure that we have diversity and flexibility when it comes to vaccine supply chains.
Canada has not only one of the most diverse vaccine portfolios in the world, we also have secured the largest number of doses per capita of any country in the world. This approach of ensuring diversity and volume months ago is what now gives us the flexibility and margins to remain on track in difficult times.
As one of the most diverse vaccine portfolios in the world, and we have also secured the largest number of doses per capita of any country in the world. This approach of ensuring diversity and volume months ago is what now gives us flexibility and margins to remain on track in difficult times. I and my Department of Public Services and Procurement Canada remain in constant contact with Pfizer as well as our other suppliers. As I said earlier, this is a temporary situation and it does not impact our government's goal of having enough approved vaccines for every Canadian who wants to be vaccinated by the end of this coming September. Thank you. Merci, Megwetch.
Good morning, bonjour à toutes et à tous. So we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Currently, there are almost 78,000 active cases in Canada, which is about 5,000 more active cases than a month ago. The total number of cumulative cases is now almost 689,000. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date in Canada, there have been 23 cases with the B.1.1.17 variant first reported in the United Kingdom, and 2 cases with the 501Y.V2 variant first reported in South Africa. So slide 1. Oh, sorry. Let Dr. New do his French.
Bonjour à tous.
Good morning. Today, we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Currently, there are almost 78,000 active cases in Canada, which is about 5,000 more active cases than a month ago. During the same time period, the total number of cumulative cases increased to almost 689,000 cases. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date, in Canada, there have been 23 cases with the variant first reported in the United Kingdom and 2 cases with the variant first reported in South Africa.
So the daily case count continues to far exceed the peak of the first wave, and early signs of leveling off for most of December have been replaced by a sharp rise in cases in late December following the holidays. On average, over 7,600 cases are being reported daily. Unless public health measures are further intensified, we will not be able to sufficiently suppress the current rate of epidemic growth.
Diapositive 1. Le nombre
Slide 1. Daily case counts continue to far exceed the peak of the first wave, and early signs of leveling off for most of December have been replaced by a sharp rise in cases in late December following the holidays. On average, over 7,600 cases are being reported daily. Unless public health measures are further intensified, we will not be able to sufficiently suppress the current rate of epidemic growth.
Slide 2. The ongoing rapid growth of the epidemic in Canada is driven by continuing high incidence in provinces west of the Atlantic region, particularly in Canada's most populous provinces, Ontario and Quebec. Many provinces, including those that had been on a downward trajectory, like BC, Alberta, and Saskatchewan, saw a sharp rise in daily case numbers after the holidays. This is likely due to a combination of people having more contacts over the holidays and somewhat reduced health seeking and testing during those weeks. Before and since the holidays, community-level public health measures have been strengthened across Canada, with some areas showing that early, strong, and consistent public health measures is what works best to slow growth, maintain low levels of activity, or eliminate transmission from an area. However, we have yet to see the kind of widespread and sustained declines in daily case counts that would indicate we are bringing the pandemic under control nationally.
Diapositive 2.
Slide 2. Ongoing rapid growth of the epidemic in Canada is being heavily driven by continuing high incidence in provinces west of the Atlantic region, particularly in Canada's most populous provinces, Ontario and Quebec. Many provinces, including those that have been on a downward trajectory, like BC, Alberta, and Saskatchewan, saw a sharp rise in daily case counts after the holidays. This is likely due to a combination of people having more contacts over the holidays and somewhat reduced health seeking and testing during those weeks. Before and since the holidays, community-level public health measures have been strengthened across Canada, with some areas showing that early, strong, and consistent public health measures is what works best to slow the growth, maintain low levels of activity, or eliminate transmission from an area. However, we have yet to see the kind of widespread and sustained declines in daily case counts that would indicate we are bringing the pandemic under control nationally.
Slide 3. Since the last modeling update, the number of health regions reporting over 100 cases per 100,000 population, the darker blue areas, has increased from 49 to 59 as rapid growth continues to expand into more areas. Over the past 2 weeks, a number of large urban centers, as well as some rural and remote communities, are reporting infection rates above 100 cases per 100,000 population. Some Atlantic provinces have been able to sustain sufficient measures to interrupt spread and maintain strong control of COVID-19. However, more recently, New Brunswick has a record high number of weekly cases, highlighting the challenges and setbacks associated with easing restrictions. In Nunavut, a 2-week territory-wide restriction period in November was successful in eliminating community transmission in areas of the territory affected by an importation case and sharp spike in locally acquired cases.
Diapositive 3.
Slide 3. Since the last modeling update, the number of health regions reporting over 100 cases per 100,000 population, the dark blue areas, has increased from 49 to 59 as rapid growth continues to expand into more areas. Over the past 2 weeks, a number of large urban centers, as well as some rural and remote communities, are reporting infection rates above 100 cases per 100,000 population. Some Atlantic provinces have been able to sustain sufficient measures to interrupt spread and maintain strong control of COVID-19. However, more recently, New Brunswick has had a record high number of weekly cases, highlighting the challenges and setbacks associated with easing restrictions. In Nunavut, a 2-week territory-wide restriction period in November was successful in eliminating community transmission in areas of the territory affected by an importation case and sharp spike in locally acquired cases.
Across Canada, the incidence of COVID-19 has been consistently high in all age groups for many weeks. However, incidence is highest and continuing to escalate among persons 80 years and older who are at a high risk of severe outcomes, including death.
Diapositive 4.
Slide 4. Across Canada, incidence of COVID-19 has been consistently high in all age groups for many weeks. However, incidence is highest and continuing to escalate among adults 80 years and older who are at high risk for severe outcomes, including death.
Slide 5. Ongoing high rates of infection in communities continuously leads to new infections, more and larger outbreaks, including in high-risk settings, such as hospitals, long-term care homes, correctional facilities, and shelters, where spread is further amplified in these closed settings. As community transmission further intensifies with sustained high rates of infection, there have been an increased number of outbreaks in long-term care facilities, ranging in size from a few cases to over 100. This is a difficult cycle of spread that can't be managed through outbreak response alone. Bringing infection rates down to stop the spread into high-risk settings requires individual and public health authorities working together.
Diapositive 5.
Slide 5. Ongoing high rates of infection in communities continuously leads to new infections, more and larger outbreaks, including in high-risk settings, such as hospitals, long-term care facilities, correctional facilities, and shelters, where spread is further amplified in these closed settings. As community transmission further intensifies with sustained high rates of infection, there have been an increasing number of outbreaks in long-term care facilities, ranging in size from a few cases to over 100 cases. This is a difficult cycle of spread that can't be managed through outbreak response alone. Bringing infection rates down to stop the spread into high-risk settings requires individual and public health authorities working together.
Slide 6. Hospitalizations have been steadily increasing since late October. Over the past week, an average of over 4,700 people with COVID-19 were being treated in Canadian hospitals on any given day, including 875 of whom were in ICUs. On average, the length of stay for people hospitalized is about 16 days, or about 20 days for those experiencing more severe illness. Increasing demands on the healthcare system is straining capacity and leaving the health workforce exhausted in many areas of the country. If the growth in cases continue at the current rate in heavily impacted areas, the ability to continue with the present level of elective procedures will become increasingly difficult.
Diapositive 6.
Slide 6. Hospitalizations have been steadily increasing since late October. Over the past week, an average of over 4,700 people with COVID-19 were being treated in Canadian hospitals on any given day, including 875 of whom were in ICUs. On average, the length of stay for people hospitalized for COVID-19 is of about 16 days, or about 20 days for those experiencing more severe illness. Increasing demands on the healthcare system is straining capacity and leaving the health workforce exhausted in many areas of the country. If the growth in cases continue at the current rate in heavily impacted areas, the ability to continue with the present level of elective procedures will become increasingly difficult.
Slide 7. Deaths are the late indicators of COVID-19 severity and lag behind increases in reported cases by several weeks. Over the past 7 days, an average of 137 deaths have been reported daily. Those age 80 years account for 71% of all deaths, and those aged 60 to 79 years accounting for 26%. A majority of deaths continue to be linked to outbreaks in long-term care homes. People of any age can experience severe or prolonged illness due to COVID-19. Today, 70 deaths have been reported in adults 20 to 39 years of age.
Diapositive set.
Slide 7. Deaths are late indicators of COVID-19 severity and lag behind increases in reported cases by several weeks. Over the past 7 days, an average of 137 deaths have been reported daily. Those aged 80 years accounting for 71% of all deaths, and those aged 60 to 79 years account for 26%. A majority of deaths continue to be linked to outbreaks in long-term care homes. People of any age can experience severe or prolonged illness due to COVID-19. To date, 70 deaths have been reported in adults 20 to 39 years of age.
Based on Canadian data up to January the 9th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to January the 24th. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 752,400 to 796,630 by January the 24th. The graph on the right shows the predicted number of deaths could be in the range of 18,570 to 19,630 by January the 24th.
Diapositive 8.
Slide 8. Based on Canadian data up to January 9th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to January 24th. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 752,400 to 796,630 by January 24th. The graph on the right shows the predicted number of deaths could be in the range of 18,570 to 19,630 by January 24th.
This long-range forecast shows how the epidemic could evolve over the next 2 months. We are forecast to have 10,000 cases daily by the end of January, with increasing hospitalizations and deaths expected to continue to follow the rising case numbers. Bending the curve of this resurgence, blue line trajectory, requires urgent, consistent, strong, and combined efforts of individuals and local authorities. For all of us, that means we must maintain physical distancing, reduce contacts outside of our household to just essential activities, continue with good hand washing practices, and wear face masks to protect ourselves and others. For local authorities, particularly where the virus is surging, this means that immediate implementation of strong restrictions, closures, and control measures is required to achieve the reductions in contacts necessary to arrest climbing numbers. As we've been saying all along, if we ease measures too soon, the epidemic will resurge even stronger. This is why measures need to be consistent and sustained long enough to sufficiently suppress epidemic growth to allow for lasting control.
Diapositive 9.
Slide 9. This longer-range forecast shows how the epidemic could evolve over the next 2 months. We are forecast to have 10,000 cases daily by end of January, with increasing hospitalizations and deaths expected to continue to follow the rising case numbers, unless immediate and significant reductions in contact rates are achieved. Bending the curve of this resurgence, blue line trajectory, requires urgent, consistent, strong, and combined efforts of individual Canadians and local authorities. For all of us, that means we must maintain physical distancing, reduce contacts outside of our household to just essential activities, continue with good hand washing practices, and wear a face mask to protect ourselves and others. For local authorities, particularly where the virus is surging, this means that immediate implementation of strong restrictions, closures, and control measures is required to achieve the reductions in contacts necessary to arrest climbing numbers. As we've been saying all along, if we ease measures too soon, the epidemic will resurge even more strongly. This is why measures need to be consistent and sustained long enough to sufficiently suppress epidemic growth to allow for lasting control.
Experiences of other countries also show us the challenges that still lie ahead and why we need early, strong, and sustained action to stop surges and keep COVID activity low. France experienced a very large resurgence in the fall. They implemented strong measures in late October, aiming to drive new infections down from 50,000 a day to 5,000 to maintain critical care capacity. After easing restrictions over the holidays, cases have started rising again, and stronger measures, including a nationwide curfew, are to take effect this weekend. Germany implemented stronger public health measures than they have ever used in mid-December, which kept case counts from increasing over the holiday period and increased them further after a small post-holiday surge to limit their epidemic growth. As the United Kingdom and Ireland eased public health measures, increased social activity over the holiday period, together with emergence of a more transmissible virus variant, contributes to the largest surge in cases yet. New, strong public health measures were needed to quickly suppress epidemic activity and preserve critical care capacity.
Diapositive 10.
Slide 10. The experiences of other countries also show us the challenges that still lie ahead and why we need early, strong, and sustained action to stop surges and keep COVID activity low. France experienced a very large resurgence in the fall. They implemented strong measures in late October, aiming to drive new infections down from 50,000 daily to 5,000 daily to maintain critical care capacity. After easing restrictions over the holidays, cases have started rising again, and stronger measures, including a nationwide curfew, are to take effect this weekend. Germany implemented stronger public health measures than they have ever used in mid-December, which kept case counts from increasing over the holiday period and increased them further after a small post-holiday surge to limit their epidemic growth. As the United Kingdom and Ireland eased public health measures, increased social activity over the holiday period, together with the emergence of a more transmissible virus variant, contributed to the largest surge in cases yet. New, strong public health measures were needed to quickly suppress epidemic activity and preserve critical care capacity.
The arrival and initial rollout of safe and effective COVID-19 vaccines is a beacon of hope. But first, we need to flatten the curve once again, while vaccine rollout begins for priority populations. Everyone needs to follow local public health advice and reduce non-essential activities and outings to a minimum. Resurgence of COVID-19 activity is happening in many parts of the world, including the appearance of variants of concern that may spread more easily. For this reason, non-essential travel outside of Canada needs to be avoided, and all travelers coming into Canada must observe the 14-day quarantine to protect family and community. The next months will be hard as we work together to bring COVID activity under control to a level that will enable public health to test, trace, and isolate quickly and effectively. Our healthcare system is currently stretched, and health workers are exhausted, so they need our support. As vaccine supply increases, COVID-19 vaccine implementation will be one of the most complex undertakings in the history of public health. We know that Canadians are tired and that the winter months will be very challenging as we continue to grapple with high rates of infection in many areas of the country. Often, the end of the race is the hardest part, but it won't last forever. For now, we must redouble our efforts at this pivotal moment and get this done. Thank you.
Diapositive 11.
Slide 11. The arrival and initial rollout of safe and effective COVID-19 vaccines is a beacon of hope. But first, we need to flatten the curve once again while vaccine rollout begins for priority populations. Everyone needs to follow local public health advice and reduce non-essential activities and outings to a minimum. Resurgence of COVID-19 activity is happening in many parts of the world, including the appearance of variants of concern that may spread more easily. For this reason, non-essential travel outside of Canada needs to be avoided, and all travelers coming into Canada must observe 14-day quarantines to protect families and communities. The next months will be hard as we work together to bring COVID activity under control to a level that will enable public health to test, trace, and isolate quickly and effectively. Our healthcare system is currently stretched, and healthcare workers are exhausted, so they need our support. As vaccine supply increases, COVID-19 vaccine implementation will be one of the most complex undertakings in the history of public health. We know that Canadians are tired and that the winter months will be very challenging as we continue to grapple with the high rates of infection in many areas of the country. Often, the end of the race is the hardest part, but it won't last forever. For now, we must redouble our efforts at this pivotal moment and get this done. Thank you.
Alors, nous devons commencer.
So we will start with two questions on the phone lines.
Prendre la première question.
We'll take the first question now, please.
Take the first question from the phone.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question, est d'Émilie Bergeron, agence QMI. Please go ahead, la parole est à vous.
Oui, bonjour. Une première question.
Hi, good morning. The first question is regarding the projections. How much time could we wait before, or do we need to wait before we see the impacts of the first dose of vaccines on your regular projections? How long will it take to see the effects? Thank you for the question. This is Dr. New speaking. We are currently working with our modeling experts to predict what the impacts of the vaccination program will be. It's an ongoing project. It is difficult because right now, given the administration of the vaccines, as well as the procurement process, and also the increasing infection rates in various areas across the country, well, there are many factors to consider, so it's difficult to predict exactly when we will see the impacts of the vaccination campaigns. But we are continuing our efforts, and it's important to highlight the fact that we all need to continue to follow public health guidelines while we wait for everyone to have their turn at being vaccinated.
My second question is is for
Hang on, we're
Minister
just going to have that
Anand.
response repeated in English. Thanks.
Can
Um,
I?
Okay, yeah. The question was about when we might see in terms of projections with respect to the vaccination efforts. What we can say is that certainly there are experts within the agency and also outside are working in terms of the data to see what effect it might have in the sort of in the mid and long term. But at the present time, it's really difficult to say. There's so many factors involved. Even today, we're seeing issues in terms of vaccine supply, how vaccines are being rolled out across the country. There's other factors in terms of the increasing rates of infection in various parts of the country. So there are many different factors in play. And certainly at this point, it is difficult to say, but we're looking forward to obviously having more data and being able to say something in the future.
Can I just add that what works, and you've seen it in Canada, but in Europe, look at those European countries with the rapidly resurging in cases, the public health measures work. The vaccine in the short term is not going to make any difference to the transmission and that projection. The vaccines are protecting the priority groups right now. So you've seen the graph also with the long-term care facilities. That is why vaccinating this population is of primary importance. That will protect them as individuals who are at the highest risk and protecting the healthcare workers who support them and who may also be at the risk of transmitting in those settings as well. So that is the effect that we would like to, of course, follow up on first. But in terms of the national projections and the transmission in communities, that is not, you're not going to see that in the initial months. And so, which is why I think our message at the end of our presentation is absolutely get on with the public health measures, do all of those things, don't do non-essential travel. All of that really counts, it works. And when you can suppress that projection, the vaccines have a longer runway, that you're giving them some space for those vaccine programs to be implemented for the vaccine to begin to work.
Follow-up?
Yes, my follow-up is for Minister Anand. I just want to know about the delay you mentioned for the Pfizer doses. Did Pfizer give you an estimated date where we would go back to normal? So, in other words, how long could we see some delays in Canada? And do we have an idea of how many doses are affected by this?
Je peux répondre en français.
Thank you very much. I can respond in French if you would like. What would you rather? Yes, French would be great. Thank you for the question. I want to be clear. This is a temporary delay and not a loss in the number of vaccines we are going to obtain. The doses will be delivered a little bit later. We continue to obtain information on a weekly basis from Pfizer. And so far, Pfizer has been speaking with the Public Health Agency of Canada and Mr. Denis Fortin as well. We will get more information over the next few weeks, and we will have more information to share over the next few hours, I believe. For now, I want to clearly state that this is temporary. We will, I believe, be obtaining 6 million doses before the end of March, as I already stated, because it's a temporary delay. And over the next few weeks, we will be obtaining more doses after the stoppage.
The reduced number of vaccines. Donc, je vais parler en anglais maintenant.
So I'll repeat the same thing in English now.
This is a temporary reduction. It's not a stoppage. So we are going to see continued vaccines coming in from Pfizer and, of course, Moderna over the next weeks. But there will be a reduction in doses, and that is the purpose of my being here. It is going to be temporary. It's not a loss, and we will make up those doses. Pfizer has told us that those doses will continue to arrive in greater numbers throughout the month of February and March, so that we are on track for the end of March, as I already said.
OK, prochaine question, s'il vous plaît.
Next question.
The next question, la question suivante est de Mia Robson de Canadian Press. La parole est à vous. Please go ahead.
Yeah, Dr. Tam, you said that if we lift measures too soon, we could see the infection rate just sort of bounce right back. And I'm just wondering, what do you mean by too soon? Do we have formulas or measurements or any idea of where things have to be before you don't think it's too soon to lift some of the lockdown measures that are in place?
Yeah, and those are the same that we've sort of, I think, communicated before. So you need to see your epidemic curve go down consistently, and that downward curve all the way to the bottom of that curve, and that you have enough public health capacity set up to do your testing, contact tracing, and isolation. Because when you reach that point in time, you can then see the edges of your outbreaks and begin to be able to manage them. You've seen that in some of the provinces with the lower number of cases, when you can see where they are and maybe their outbreaks and such, you can rapidly test and reduce the further spread. So breaking those chains of transmission is very difficult to do when you've got so much community transmission going on. So that would be a really critical sort of indicator for sure. And but because in so many areas of the country, the virus is spreading in the community, the moment that you lift some of those or increase contacts, basically, for individuals, it's expected that the virus will surge. So getting that capacity there is very important. Of course, provinces are also tracking their hospitalizations, ICU admissions in terms of keeping the activity down below the capacity to cope for the health system as well.
Thank you. And I'm also curious with the new variants that we're talking about and the suggestion that they are more easily transmitted than what we've seen to date. Just wondering if that's been taken into account in the modeling numbers at all. If we'll only mark, I think, 22 of cases of those variants, but likely there are more. And if we have included that in our modeling at all.
Not in what I've shown in these slides, but yes, modeling has been done on looking at, so basically you're making some assumptions on the reproduction number, for example, and expanding that. And that modeling has been done in our scenarios. And I believe those get posted on our website on a consistent basis. This is what the modeling working group is doing. But essentially, yes, will be the answer. We're modeling the impact of variants. And I think, not surprisingly, if you have a variant that's more transmissible, there is definitely a risk of resurgence, for which the measures, although they're the same, really the same public health measures, need to be that much more stringently applied in order to get those kind of resurgences under control.
Oui, nous sommes toujours en...
Yes. We are always using the data on the variants in our modeling. Yes, I can say that it is being included in our analyses. What else? Inaudible to the interpreter, question from the journalist in the room. Currently, with the variants, the number of cases of the variants that we've heard about so far, well, we are using those numbers in our modeling. And as we get more data, we will include them in our analyses and future modeling.
What we have asked for, though, is any time there's a uptick in numbers, for example, I would say New Brunswick. New Brunswick has had more cases. So those get sent to the National Microbiology Lab for sequencing. Because what you want to say is, well, is it we do have epidemiologic data at the local level. So actually, someone had an event or someone had, they could trace those kind of clusters. At the same time, you still want to analyze the genetics just to see if that's contributing. And we have not found that, for example, in that setting. So that's part of the genomic testing strategy. So at the moment, those sequencing is ongoing to look at three really fundamental ways of looking at the impact of the variants. One is more widespread, general sampling for looking at the genetics of the viruses around. Two is more targeted, for example, for travelers and for certain super spreading events or certain outbreaks or people who have reinfection. We would definitely want to sequence people who may have an infection after they've been vaccinated. So there's a sort of strategy in place to look for any introduction or the potential impact of the variants.
Je peux répéter en français.
I can repeat that in French. We currently have an integrated monitoring system to detect the variants at the National Microbiology Lab in Winnipeg and with their provincial and territorial partners. And there are also other stakeholders. There are three main points and pillars to our monitoring. We do some sampling through our general monitoring system. We continue to collect certain samples for genetic sequencing. And we do, for example, look at super spreading events. We ask for samples from those events to do genetic sequencing. And when people and travelers arrive in Canada from outside the country, if they test positive for COVID-19, we do test for the variant as well. And there are certain other situations as well. If there is any activity that's a little bit more suspicious, of course, the laboratory and our partners will conduct the analyses. Dr. Tam is also looking into cases where people got the first dose of the vaccine to see whether, if anybody catches COVID-19 after that, we'll be looking at the genetic sequencing as well to see if there has been an impact on the variants. We'll take questions in the room.
Go ahead, David.
Hi, David Thurton, CBC News. Minister Anand, good morning. The first question I just want to ask you is that Major General Danny Fortin said that we should expect to see about, on a weekly basis, about 208,000 Pfizer doses coming into the country for January. So I'm just wondering, for provinces, for Indigenous communities, the few that can take this vaccine, and even people in long-term care homes and doctors who are desperate to get this vaccine, should they be prepared to see less of what was expected to come into the country, given this new development with manufacturing?
Thank you so much for the question and good morning. At the current time, my knowledge is based on my conversation with Pfizer as of last night, and I have given you all that I know. I am aware at this morning that Pfizer is speaking with the Public Health Agency of Canada to further provide information relating to the numbers over the next weeks so that planning can take place. And I believe that there is a press conference later today, and hopefully those numbers will be available. But the purpose of the meeting last night with Pfizer, I believe, and me and my department was to provide the information that there would be a reduction of the doses that would be delivered to Canada in the very short term, but that we would be making up that pace of delivery by the end of Q1. We still anticipate getting a total of 20 million doses in Q2 from the currently approved vaccine manufacturers. We still anticipate being on track to vaccinate all Canadians who wish to be immunized by the end of September via approved vaccines. And so, as I have reiterated, this is a temporary issue in terms of the reduction of doses, but that pace will pick up towards the middle and end of February and into March. And we are on track for Q2 and the rest of the year. Thank you.
Okay, just totally different question. Dr. Tam, I just wanted to get your take on what the BC's Premier John Horgan said yesterday, that they're considering their legal options. What are their options when it comes to closing their borders to reduce the amount of infected people that are coming in, adopting a similar approach that the Atlantic provinces have adopted. Can you tell us, do you think that this is a good idea? Should we see a BC bubble? And if you can't be as definitive, because sometimes you aren't, what are the challenges? What are the positives of having these sort of provincial bubbles or restrictions?
I think fundamentally, the public health measures are there to reduce contacts and spread. So anything that can reduce the number of contacts people have with each other is one of those measures. So reducing importations from other areas of Canada is, one way of looking at it. So that is what the province is looking at. You've seen very regionalized approach. You've seen the territories taking into account their own context and set of circumstances as to what they may need to do. So I'm sure it's a very difficult, decision. But I think the general message is, though, even domestically, try not to undertake non-essential travel is actually important, not just for the international context at the moment. I think for now, if you're vacationing, and traveling across Canada, this is not the time to be doing non-essential travel. You've seen the provinces of Quebec and Ontario looking at reducing the mobility of the population by their public health announcements. So the whole concept of reducing contact is basically what you're talking about, and people are looking at different ways of doing that.
The issue of interprovincial travel is, to me, an issue that really highlights this point to everybody. It's very important to limit non-essential travel anywhere. Just to add to what Dr. Tam was saying, just within Ontario, the message is stay at home, not travel from one city to another. We could talk about interprovincial travel, but it's the same thing within any given province, whether it's in Ontario or Quebec. That's the point. We're trying to drive home. That's the first goal of the provinces and territories, to limit the movement of people. But what I can say is just to highlight the point that Dr. Tam and all public health officials have said for many months now: limit contact, stay home.
Oui, Laurence Martin, Radio-Canada. Ma première question est pour la ministre Anne.
Laurence Martin from Radio-Canada. My first question is for Minister Anand. I know we have few details, but I'm just trying to clarify what's going on. We're talking about a temporary delay, a reduction in production for how long? Decrease of what percentage? 25%, 50%, 75%? Also, how long will this delay last?
Minister Anand?
Yes, I'm here, but I can't hear the question anymore.
Okay, let's repeat that.
Je vais juste répéter la question.
I'll just repeat the question. I just wanted to clarify for the delays in Pfizer's deliveries. Are we talking about delays of a few weeks? I mean, how long of a delay are we looking at? End of January, early February? And also, what will the decrease in production be? 25%, 50%, 75% of what we were expecting, just so we have an idea?
Merci beaucoup. Comme j'ai dit,
Thank you very much. As I already stated, we will be obtaining more information with more numbers, but it is a temporary reduction. We already heard from Pfizer that the vaccine deliveries will be delayed by perhaps 2 or 3 weeks, not a very long time at all. And I don't know how much their production has been decreased by, but I will be obtaining that information. We will be obtaining it today, I hope. Thank you. And my next question is for you, Dr. New. We saw your projections. They're not very encouraging, more than 10,000 cases by the end of January. To what point is that increase driven by the new variants or people who didn't follow the public health guidelines during the holidays? It's more than 2 weeks after Christmas, so we're starting to see the impacts. What is the cause of this increase? Well, based on the data that we have received, it's really an issue of people increasing their social contacts. We saw an increase in the number of infections after the holidays. That's why Quebec, Ontario, and a number of provinces are seeing that they now have to put in place stricter public health measures, as we've seen in Quebec with the curfew. The introduction of the variant is a variant or a factor, perhaps. It could be a factor in the future because it does make the virus more transmissible. But really, it again highlights the point that we need to continue to implement our public health measures. It might be even more important to do so with a variant, but it's the same things we've been saying for months. Wear a mask, ensure social and physical distancing, and so on. We see that Canadians are tired. They no longer want to follow the public health measures. And it's the same thing. Of course, we understand our winter is long. It is difficult. It's the month of January, February, but we need to continue with them. The vaccines are a beacon of hope, but they're not going to have any kind of immediate impact. Vaccines are for the long term. Right now, our healthcare systems are at a critical point. They are being overloaded. So we need to take immediate action.
Okay, Marika, go ahead.
Hi there, Marika Walsh with the Globe and Mail. Good morning. Just a question for my colleagues, for Minister Anand. Drug makers, including Pfizer, have said that access to COVID-19 vaccines came up in their discussion with your government about the new regulations to reduce drug prices. Did Pfizer, Moderna, or any vaccine producers threaten to withhold COVID-19 vaccines from Canada if the new regulations came into effect? And did the government delay the new regulations because of concerns over access to the vaccine?
Thank you, Marika. Not at all. The issue did not come up in terms of my conversations with the drug makers. I've had no conversations relating to the implementation of the regulations that you referred to at all in those conversations. And I haven't been involved actually in terms of those decisions with Minister of Health at all.
Okay, thank you so much for the direct answer. My next question is for Dr. Tam or Dr. New. I'm just wondering, given the modeling we're seeing, given that it's now, the new projection is 10,000 daily new cases by the end of January. It was previously predicted that if we maintained contacts, it would be 10,000 daily new cases by the end of December. So does that actually mean that people have actually reduced their contacts a bit, at least, that it has slowed since the projections from November? Or is that not the right interpretation?
I think our projections were going the right direction ahead of Christmas. In fact, we give intermittent updates, and when we said 10,000, it actually went down a bit, the projections, as the epidemic curve, as you've seen, leveled off for a number of days. But now, after the holiday period, we're seeing this surge. The projections are going up again. It will come down again, by the way, if people working together with public health do reduce their contact. Our next set of projections could be lower. And so it's all sort of fluctuates and dependent on what actually happens in real time, basically. But yes, it did swing into the better space, and then now it's swung the other way.
Okay, we'll go back to the phone for two further questions. Start with first one.
Thank you. The next question, la question suivante est de Catherine Levesque, La Presse canadienne. La parole est à vous. Please go ahead.
Oui, bonjour tout le monde.
Good morning, everyone. It'll be a question in the same vein as my colleagues. Dr. New, you mentioned that during the last set of modeling, it was predicted that we'd see more than 10,000 cases per day. And now you're saying that there was increased contact, that people let down their guard over the holidays. But at the same time, we can see that your projections today are the same as those in December. So is that positive news? Did people actually reduce their contacts since the projections are not as bad as we thought in the end? Okay, thank you for the question. My answer will be the same as Dr. Tam's, I think. Last time, we had a information session with the modeling. We were in a better space, that is in a better position. That is, we may see fewer cases per day, but after the holidays, we're starting. I mean, we'll be hearing about further cases over the next few days and weeks, but all the indicators, all that are that gatherings over the holidays meant that people had more contacts than before, and now we're going to see the impacts. That's why the governments of a number of provinces, such as those of Quebec and Ontario, have started putting in more restrictive measures, such as a curfew in Quebec. So we'll have to see what the results of the current measures will be. The curfew in Quebec will last until the beginning of the month of February. We hope that with the other measures, including the curfew, people will really seriously consider what's happening right now. I am in communication with my counterparts in Quebec. They are exhausted, discouraged. I've seen many interviews with doctors in Quebec, in emergency rooms, intensive care units, and healthcare staff. They have worked so hard for the past year almost. Since February, March 2020. 2020. That's right, 2020. I'm mixing up my years. But we're really in a serious situation here. But I really need to highlight the point that we're all in the same boat. It's not just governments, doctors, public health agencies. It's teamwork that we need, working together with everybody. Thank you.
Okay, merci beaucoup.
Thank you. And my follow-up question is for Ms. Anand regarding the Pfizer information. I understand that there will be more information coming in the next few hours. However, could you tell us whether all countries will be impacted by those delays? Will all countries be equally affected? For example, will Israel see the same delay or decrease? Or do you have any information that might indicate that Pfizer might be concluding agreements with various countries depending on who's a priority?
Merci beaucoup pour la question.
Thank you very much for the question. I understand that Pfizer will be dealing with all the countries that have ordered doses. In other words, I understand from that they'll be treating them the same.
That all countries that are receiving doses from Pfizer's European facility will be equitably treated in terms of the reductions. In terms of specifics about how each country is going to be treated, of course, I don't have that information, but they mentioned to me in my conversation that they are very concerned to make sure that countries are fairly treated across the board in terms of the temporary reduction that is being faced. I want to reiterate, though, that we do anticipate making up those doses in Q1. We do anticipate having millions and millions of doses from both Pfizer and Moderna coming into this country in Q2, as I've already said. Et ça, c'est très, très important de se souvenir.
It's very important to remember that Canadians will have access to the doses of the Moderna and Pfizer vaccines before the end of the second quarter and during this third quarter as well. We will have enough vaccine doses for all Canadians who wish to be vaccinated by the end of September, and we will receive a combined total of 90 million doses from Pfizer and Moderna by the end of the year. So it's very important to remember that. Thank you.
We'll take one additional question from the phone.
La question suivante. The next question is from Steve Shear with Reuters. Please go ahead. La parole est à vous.
Good morning. I wanted to ask about the difference between the federal recommendations on the interval between the two shots and that in Quebec. So Quebec says they may space out the doses for the vaccines by 90 days, but it was 42 days was the federal recommendation. I guess I'm wondering if do you think it's okay to extend it for more than 42 days? And what is your message to Quebec?
It's Dr. New here. Maybe I can start. So certainly what you're referring to, the National Advisory Committee on Immunization, is a national body. It's a committee that reports to the Public Health Agency of Canada with experts throughout the country. So based on their analysis of the available data of the two approved vaccines, they're looking at the dosing intervals of 21, 28 days for the two vaccines, Moderna and Pfizer, and what's available. They looked at the data, as also has the expert committee that works for the WHO. And based on the available data, they determined that the dosing interval, under exceptional circumstances, could be extended up to 42 days based on the available data, and that there should be no drop-off or loss in terms of the efficacy of the vaccine. So that is the data out there. That is the recommendation. But there's also the acknowledgement by NACI that provinces and territories will have to take that into account, their own exceptional circumstances, whatever they may be, the epidemiology, supply management issues, etc. And so my understanding, and I can't speak for Quebec, is that Quebec's own immunization committee, probably looking at some of the data specific to Quebec in terms of its epidemiology and the other factors involved, took that into account in terms of whatever its determination and recommendation to the government of Quebec. So that is unique to the Quebec situation, and that's why it may, in some ways, be somewhat maybe different in some respects to what has been put out by NACI. I'm not sure if Dr. Tam, maybe would like to add anything.
So just so that there is a commitment to collect data in real time for any extensions of that interval. So I think that's really key, because then you can actually assess, the vaccine efficacy or vaccine effectiveness really in real time, and share that with with others. That's really key. But I don't have anything else to add to what Dr. New has just said.
Steve, follow up.
Yeah, I guess my question would be, are you concerned that Quebec is being forced to delay that second dose for much longer than the recommendation coming from I can't remember the name of the group now, but they are extending it much longer, and is that concerning for you guys? And do you think that that provinces should try to follow the guidelines, or is it acceptable that they extend these the delay between the doses, given the scarcity of the vaccine right now?
So I think the Chief Medical Officers of Health have put out a statement, and following the NACI statement, and in support of what NACI has said, and that's what Dr. New had expressed. And collecting any information, collecting data for any extension of that interval is really critical. The bottom line, though, is as the experts look at the data, you also take into account past experiences with vaccines that are given in serial intervals. So some of the considerations are the fact that that interval, that 4-week interval, is quite a short interval when you actually think about how vaccine doses that are given in multiple doses are normally given. But that is the limitation of the clinical trial and the interval that they've set in the trial. But in terms of how vaccines normally work, they are often given intervals much longer than this 4 weeks. So I think that's how some of the Quebec deliberations have been. What I would suggest is that I think it's important for that cohesion, but it's also important for us to keep looking at the data, because we will also have international data from Israel or from the UK or from any other place, from the companies themselves, and that we must be able to sort of adapt our immunization approach as the data is presented as well.
Dernière question de la salle.
Last question in the room. Yes. Still with Radio-Canada, regarding the impacts of the vaccine on the modeling. I know that you said at the beginning of the press conference that it was too early to say, but just so people understand, is it an impact that we might see near the end of spring, in early summer, over the summer? As Ms. Anand said, the objective is the same. We want to vaccinate everybody who wants to be vaccinated by the end of September. In the meantime, will we see an impact on the numbers? What I can say is that, yes, of course, there is a beacon of hope with the vaccines, but we won't be able to say that we'll be able to see an impact by a certain date. Within the agency, we've been holding many discussions, and the concern in the end is that, well, vaccines have come in. Everybody will say that's a solution, but that's not the case, because if we don't continue with good public health practices, there will be no impacts from the vaccine. We can see right now what's happening in Quebec and Ontario, many regions across the country. We also need to see what's happening within the population with the public health agencies to see what the rate of infections are, the number of contacts between people right now. We are starting with the vaccines with priority groups. That's very important for protecting them. But to really see a change at the population level, it's really difficult to predict. I want to add something. For the first quarter, for example, it will be very important to monitor the projections, for example, for mortality, because the first group receiving the vaccine is elderly people, people in long-term care homes. So that may be the first sign that would signal the effectiveness of the vaccine. So perhaps looking at that projection would help, and that projection will be reduced. The numbers will be reduced. But there is not enough data based on the effectiveness of the vaccine in reducing the transmission and the transmissibility of COVID-19. We will have more data in future. Now, the other observation from what we've seen in other countries and to share information with our international counterparts, well, there is knowledge and data regarding the transmissibility, the effectiveness, and how to reduce that transmissibility. That's the information we're waiting for. It's very important for our projections, but we have all kinds of data. We are adding yet more to try to get a more accurate idea of the situation for public health measures. Now, based on your predictions, on your projections, are you thinking that there will be a decrease in the mortality rate by the end of March, let's say? Well, I can say perhaps, but not completely, because if the transmission rate is still high in the community, it's very difficult to assess the impact in certain populations. So we'll see. Like we've already said, it's going to be a combination of strategies to reduce epidemic rates.
I think our model suggests that you can't just have vaccines. Right? We don't know enough. We don't know enough about transmission. If your community transmission is still high, the vaccines alone is not going to make a dent in some of that. But we would love to see, as the older population and long-term care receive the vaccines, that we're going to look very carefully to see if the serious illnesses and the deaths go down. But that's also a factor of what's happening in the community. You've seen how that goes up and down as a result of community transmission. So teasing out the effect of the two would be an interesting thing that we need to analyze.
Can you just clarify really quickly if the Ontario new stay-at-home order is factored into these models? Like when you say in the appendix that they need stronger measures, does that appendix factor in Ontario's stay-at-home order? Like, is more needed than the curfew and the stay-at-home order, or are those not factored in?
What the models do is numerous bits of public health measures. They throw in every layer. We talked about this.
Those things.
It includes a range of reduction in context, however you do that. So my
question is, your last slide shows that stronger health measures are needed. When they say stronger health measures, is that based on is that already factoring in the Ontario shutdown or stay-at-home order?
The projections, let me see the date. 9th of January, so no. But if you see the blue line, the forecast to suppress that curve, that takes into account the amount of contacts. So, but no, so the date we can verify. It should be at the bottom of the slide, I think. Sorry? That is what we hope. And yeah.
Okay, thanks, folks.